Assalamualaikum to our lecturer, Madam N. In this presentation, our group will be discussing an important health issue affecting millions worldwide, liver cirrhosis. Before we dive into the topic, let me introduce myself. My name is Isati Binti Erandi, and I will explain what liver cirrhosis is and its etiology. Let's start by looking at this image. Notice the difference between a healthy liver and one with cirrhosis. In this image, we can see how the smooth, functional surface of a healthy liver is replaced by rough, scar tissue in a cirrhotic liver. So, what exactly is liver cirrhosis? Cirrhosis is the development of scar tissues, fibrosis, and nodules in the liver, resulting in additional chronic damage and disruption of normal liver function. Numerous injuries can lead to liver cirrhosis, including viral infections, toxins, genetic disorders, or autoimmune mechanisms. Hepatic fibrosis occurs with each damage without immediate loss of function. However, prolonged injury leads to fibrotic liver tissue and eventual loss of functionality, resulting in liver dysfunction and progression to cirrhosis. Now, moving to the causes of cirrhosis, when the liver injured, it creates scar tissue as part of the repair process. However, with repeated injuries, this scarring becomes excessive, leading to cirrhosis. The most common causes of liver cirrhosis are hepatitis B and hepatitis C. These viral infections cause inflammation and damage. Individuals at risk include those using illegal drugs, engaging in unprotected sex, or undergoing kidney dialysis. Next, alcoholic liver disease. Excessive alcohol consumption damages liver cells, leading to scarring and preventing the liver from functioning properly. And then lastly, non-alcoholic steatohepatitis, NASH. This condition involves fat accumulation and inflammation in the liver, which can progress to cirrhosis if untreated.
Now let's move on to the sign and symptom for liver cirrhosis. Liver cirrhosis manifests with several signs that are critical for diagnosis. Teres nails are a common finding marked by a pale or white nail beds with a distinct pink band near the tips. Palmar erythema is the reddening of the palms. It's caused by the altered estrogen's metabolism. On the face, facial telangiectasia is a spider-like dilated blood vessel that often appear on the cheeks and nose due to the increase of vascular fragility. Jaundice is the yellowing of the skin as sclera result from the elevated bilirubin level caused by the liver impaired ability to process and excrete the bile. The abdomen may display caput medusa, a pattern of prominence and Koch veins radiating from the navel, linked to the portal hypertension from the obstructed blood flow in the liver. In a male patient, hormonal imbalance leads to gynecomastia, which is the enlargement of the breast tissue, testicular atrophy, and the decrease in the body hair. Liver cirrhosis can present with a symptom that impact the patient's quality of life. Muscle cramps are a common complaint, often linked to electrolyte imbalance and the altered metabolism caused by the liver dysfunctions. Poor sleep quality, including the insomnia or fragmented sleep, is frequently observed due to the hepatic encephalopathy or disrupted circadian rhythm. Patients may also experience pruritus, which is the intense itching which results from the accumulations of the bile salts in the skin due to the impaired bile secretions. Additionally, sexual dysfunction, including decreased libido or erectile issues in men, may occur due to the hormonal imbalance and the liver inability to properly metabolize the sex hormone. Liver cirrhosis can lead to several serious complications. Ascites is the accumulation of the fluids in the abdominal cavity is a common consequence of the portal hypertension and reduced protein productions by the liver. Hepatic encephalopathy occurs when the toxins such as ammonia build up in the bloodstreams due to impaired liver functions, leading to a confusions, memory issues, and even coma in a severe case. Variceal hemorrhage is a life-threatening complication arise from the ruptured esophageal or gastric varices caused by the elevated pressure in the portal vein. This complication highlights the severity of the cirrhosis and the importance of a timely medical interventions.
Hi, I'm Aina and I'll talk about pathophysiology of the liver cirrhosis. So, multiple cells play a role in liver cirrhosis, including hepatocytes and sinusoidal lining cell. Sinusoidal lining cell have three cells such as hepatic stellate cell, sinusoidal endothelium cell (SEC), and Kupffer cell (KC). So, hepatocytes are involved in cirrhosis pathogenesis. The damaged hepatocyte release the reactive oxygen species and inflammatory mediator that can promote activating HSC and liver fibrosis. So, HSC will form a part of the wall of liver sinusoid and store vitamin A. When HSC are exposed to inflammatory cytokinase, they got activated and transformed into myofibroblasts and start to deposit collagen, which result in fibrosis. Next is SEC. SEC will form the endothelial lining and characterized by the fenestration made in the wall that allow the exchange of the fluids and nutrients between the sinusoid and the hepatocytes. The defenestrations of the sinusoidal wall can occur as a result of chronic alcohol use and promote perisinusoidal fibrosis. SEC also will synthesize the nitric oxide NO and endothelin-1 ET1, which add on HSC, will cause the relaxations and contractions of the sinusoid and also controlling sinusoidal blood flow. Lastly, we have KC. KC are satellite macrophage that line the wall of sinusoid. This cell play a role in liver fibrosis by release harmful mediator when exposed to injurious agents and will act as antigen-presenting cell for viruses. So, major causes of morbidity and mortality in cardiac patients is because of the developments of portal hypertension and hyperdynamic circulation. Fibrosis and vasoregulatory changes in intrahepatically and systematically will influence the development of portal hypertension, which lead to cholesterol circulation formations and hyperdynamic circulations. So in portal hypertension, patient with CIRRHOSIS, there is an increasement in endothelial 1 and sensitivity of its receptor with a decrease in nitric oxide productions. So this lead to increased intrahepatic vasoconstrictions and resistance, which initiate the portal hypertension. So, cholesterol circulation is formed to compensate for the increases in intrahepatic pressure due to vascular resistance. So, next is hyperdynamic circulations. In systemic and splenic circulation, there is increases in nitric oxide productions, which lead to systemic and splenic vasodilation and decrease the systemic vascular resistance. This will activate the renin-angiotensin aldosterone system, which lead to sodium and water retentions and hyperdynamic circulations.
This is an axial view of the abdomen with liver cirrhosis on a CT image during the arterial piece with labeling. The image shows the appearance of liver cirrhosis during the arterial piece of a CT scan. Firstly, an irregularity is visible at the hepatic edge, fibrosis, and the growth of regenerating nodules cause hepatic margin irregularities in liver cirrhosis. These nodules and scar tissue alter the liver's natural structure, resulting in an irregular edge. Second, liver cirrhosis displays less contrast enhancement of the liver than a normal liver, and it can present with inhomogeneous enhancement due to regeneration, fibrosis, and the altered portal venous flow. Third, hepatocellular carcinoma is visible as a protrusion from the caudate loop of the liver. Hepatocellular carcinoma is the most prevalent form of primary liver cancer and is derived from the hepatocytes. Lastly, splenomegaly is present. Liver cirrhosis induces portal hypertension, which increases condensations in the portal system, resulting in splenomegaly.
This is coronal view of CT image of the abdomen in a patient with liver cirrhosis. This image was labeled with the anatomy of the surrounding structure in the abdomen region. The relationship between the abnormal finding, which is liver cirrhosis, and other neighboring structures seen in the given image. So from the image, it shows first the liver is shrunken with some nodularity and is surrounded by the ascites, which is the complication of cirrhosis. The shrunken of the liver occurs when the liver shrinks in response to severe fibrosis and loss of normal liver parenchyma. And the appearance of liver cirrhosis proven by the atrophy of the right lobe, while the caudate lobe may be hypertrophy to compensate. Second, next, also clearly can be seen that the spleen is enlarged or called splenomegaly in the left side of the image. In this image also shows a gastroesophageal varices. This condition happened when the vein of the esophagus enlarged due to the blood flow to the liver blocked by the scarring of the cirrhosis. Lastly, there is appearance of the splenorenal shunt between a tributary of splenic vein and the left renal vein in the blue circle. The splenorenal shunt is one such a collateral vessel that formed to relieve the high pressure in the portal system, which is one of the complications from the liver cirrhosis. The portal hypertension came from the scarring and fibrosis in the liver that increased resistance to the blood flow through the liver.
The image shows a sagittal view of contrast-enhanced multiplicity for patients with liver cirrhosis. The portal vein or hepatic portal vein HPV is a major blood vessel that carries blood from the gastrointestinal tract, gallbladder, pancreas, and spleen to the liver. In cases of portal vein thrombosis, a blood clot causes a blockage within the vein, leading to a filling defect that restricts blood flow to the liver. This image shows the clot in the left branch of the portal vein highlighted by the yellow arrow. The thrombus, which is the blood clot, will appear as a darker hypodense area within the vein, which non-enhanced irregular shaped mass or parted obstruction along the portal vein. And next, ascites refer to abnormal accumulation of fluids in the peritoneal cavity, which surround the liver. Cirrhosis, a condition caused by the scarring and hardening of liver tissue, leads to portal hypertension, which increases pressure in the portal vein. This increased pressure causes fluids to leak from the blood vessel and accumulate in the peritoneal cavity. On the sagittal MRCT scan, this fluid appears as hypodense dark areas, which then collect between the liver anterior surface and the abdominal wall, forming a fluid-filled space that can be seen in the scan. This accumulation of fluid is a characteristic sign of ascite in individuals with cirrhosis. And then next, where it might not be seen in this image, liver cirrhosis causes scarring that distorts the normal liver tissue. This scarring leads to nodularity, which reflects an uneven structure of the liver, to fibrosis, and heterogeneity, where these parenchymal chains may not be immediately obvious in the sagittal MRCT view. They can still be present and should be considered when evaluating other sagittal view of liver cirrhosis.
In conclusion, liver cirrhosis is a chronic condition characterized by scar tissue growth and liver nodules caused by a variety of factors, including alcohol, hepatitis, and non-alcoholic steatohepatitis. Jaundice, tearisness, and muscle cramps are common signs and symptoms, which complications including ascites, hepatic encephalopathy, and varicose hemorrhage. The pathophysiology consists of hepatocyte destruction and activation of hepatic stellate cells, which results in fibrosis. Imaging studies usually demonstrate a shrunken, irregular liver margin, splenomegaly, and ascites. early detection and management are critical for preventing progressions and eventually dealing with complications.